All right, hello and good morning, everyone. I am Jamie Cooper, founder of Cannabis Connection, and welcome to our Cannabis and Company Buzz session. Today, we are talking about COVID preparedness and response planning for cannabis businesses, and I am joined by four Cannabis Connection members. We have Connie Maxim Sparrow of Sparrow Consulting. Good morning, Connie.
Morning.
We also have John Dodge of Freshwater Digital. Good morning, John.
Good morning, Jamie. Thanks for having us.
Thanks for being here. And we have Jenny Germano joining us all the way from Denver, Colorado with ICS Consulting. Good morning, Jenny.
Good morning, Jamie.
And we have Steve Braddock here in Michigan as well with Braddock Enterprises. Good morning, Steve.
Good morning, Jamie.
It's awesome to have you all. We are streaming this live to our Facebook page right now. We will be hosting these panel discussions every Friday at 11 a.m. Eastern. And, you know, I figured COVID would be a great thing to talk about. The state last week issued a new set of guidelines for cannabis businesses. And today we're going to talk a lot about that. But first, I'm going to give all of our panelists a little time to talk about their businesses, their background, and what they have to offer the cannabis industry. Connie, we'll start with you.
Sorry about that. My phone interrupted.
Phone call coming in.
My name is Connie Maxim Sparrow. I'm the principal for Sparrow Consulting. I have been in the cannabis space in licensing and compliance and for about 4 years. I sit on the Michigan Michigan Cannabis Industry Association's Coronavirus Task Force. I have a background in emergency management, healthcare preparedness, occupational health and safety, accreditation, and compliance. I also worked in public administration for about 25 years of my life, working for the government. I have definitely spent a substantial amount of time on COVID over the course of the last 3 months. And so I'm excited to really get to talk about how the new normal, which will be in this new normal, will be for a while.
Well, we certainly appreciate bringing your expertise to the cannabis industry. So thank you for being a part of this panel today. John, please tell us a little bit about yourself and Freshwater Digital.
Yeah, Jamie. I'm a COO of Freshwater Digital. Freshwater Digital is a company that focuses on digital signage and media production. We serve specifically the digital signage space. So when you go to a Meijer or a Spartan Nash or other locations that have displays that have messaging content on them, typically that's the type of stuff that we're going to be involved in. We are not in the business of selling technology. We're in the business of selling solutions that involve technology. As it relates to the cannabis industry, we've been supporting this industry for a couple years now as it's become more prevalent in Michigan. But we have been, we're celebrating our 10th year anniversary this year, actually. So we've been around for a decade now. And some of the stuff that we're going to be talking about today is really going to be focused on returning to work, making customers feel confident again that we're taking the right steps to protect their safety.
Awesome. Thank you so much, John. And then Jenny, tell us a little bit about your company and
Sure.
what you do for the industry.
Great. My name is Jenny Germano, and I am the CEO and founder of ICS Consulting Services. I'm based out of Denver, Colorado, but I work national all across the United States. I've been in the cannabis space now for 11 years, so a little bit over a decade. And I got my first start is actually working in facilities here in Colorado, dispensaries, grows, and manufacturing facilities. And that's pretty much when I fell in love with compliance. And so my business is a compliance support business for licensed operations. And I help people with everything from training. I'm also a third-party auditor, and I come in and I audit people's facilities to ensure that they're following all state and local regulatory guidelines. As well as that, like I said, I do a lot of training. I'm also a certified ServSafe instructor here in the cannabis industry, and I train employees in manufacturing facilities out here in Colorado as well on health and sanitation and product handling practices. So I'm very happy to be here today and just try to share a little bit of knowledge and what I'm experiencing in Colorado and seeing in Michigan.
Awesome. Thank you so much, Jenny. And Steve Braddock, tell us a little bit about yourself and your business.
Thanks, Jamie. Been in the business, in the cannabis industry now for 4 years. Prior to that, started about 5 years ago in the horticulture and agricultural side of the business, and have been in business now on the energy efficiency and sustainability side for 18 years. So with that being said, we help our customers develop and design facilities. We'll build them from the ground up. We're taking an existing building and retrofit it. We'll do the material flow, the racking systems, the irrigation, the lighting simulations, the air management simulations, the reverse osmosis system. We'll design everything, install, and then once we figure out what you're growing and how you're growing, then we can develop a system to take you off the grid. So we'll build a natural gas power plant, and with that, it'll save you a significant amount of money. Very similar to your car as well, how you get heating and cooling from within your car. We're using the same type of technology, but just a larger magnitude in developing, giving you free heating and cooling for your grow facility. In addition to that, I am a business development director for Sensi Park, which is in Battle Creek. It's going to be 5 million square feet of custom condos for cannabis. And so very active in trying to facilitate getting that property filled up as we continue to move forward.
Awesome. Thank you so much, Steve. So now we're going to dive into the questions I have for each of you. What we're going to do is I'm going to go around to each panelist and ask them some questions. Connie, I would like to start with you because, you know, success in all of this and putting together the right strategy it has a lot of planning to do with it. And so what does a COVID response plan look like for different license types? And what does it look like for maybe a business that isn't a state licensed business?
So we're kind of already been exposed to what a COVID plan looks like. If you've been to the grocery store, if you've been to the doctor's office, if you've been to any kind of essential business that's been open over the course of the last 3 months, they're doing pretty good COVID response activities and strategies. This lovely advisory bulletin that came out from the MRA, and it's been updated a couple of times, actually takes you pretty step-by-step through exactly what you need to do by license type. There's lots of hyperlinks in there that take you directly to OSHA, the Occupational Health and Safety Administration for the state, as well as it takes you to links having to do with signage and things like that. This really is a great guide for everybody to be able to get going on their plan. So to get into kind of the gritty details, I'm going to avoid, because this really does that for you. Read through it, use it like a book, staple it and put it on your desk and reference it regularly. I kind of want to talk a little bit more about the highlights of what your plan needs to include. The first thing it needs to include is making sure you're ensuring social distancing of your employees as well as your customers. If you are a provisioning center or a retail adult use retail site, if you can maintain curbside or home delivery, I strongly suggest you do that. That's the best way to mitigate further spread. Another thing that we're going to need to start doing, which is you've kind of heard this buzzword lately, is you're going to have to start screening your employees daily, and you're going to have to do contact tracing. So contact tracing is basically how the public health department notifies people when somebody's been exposed to a communicable disease. That happens in a variety of settings with a variety of viruses and bacterias. But specifically, you're going to have to build into your plan a responsible person that's on duty every day, that is responsible for screening employees, and then documenting those screenings to make in your screening for fever, cough, loss of smell, or loss of taste. That's new. Some people have a history of already having a loss of smell or taste. It needs to be a new loss of smell or taste. And you need to be keeping a daily log of those things in screening. And here's the key to this. If somebody is sick, your COVID plan needs to address what you do. So if one of your employees does show up with those kinds of signs and symptoms, you need to send them home and get them tested. And they're not to come back to work until they're tested positive. Then they stay home until they've been cleared by their physician, or if they're negative, they can come back to work. But you're going to have to keep documentation of that as well. The other concept that's helping is, and we're all doing it right now, is we're sitting in our offices at home. If you have people in your hierarchy, whatever type of business type it is, and they can work from home remotely, please ensure that they do. That kind of goes along with the curbside. If you can find mitigation strategies that completely protect some, that's better than exposing everyone to a little bit of risk. You know, there's going to be, and I'm going to strongly suggest this. Obviously, the governor's made it through executive order a face mask. You do not need an N95, and you do not need any of the more escalated PPE that we're trying to reserve for healthcare workers. I want everybody to be careful with this and make sure that you do have a face mask that follows the CDC guidance. It's in that executive order, in that bulletin. You can go right in there and click on what type of face masks are appropriate, but people need to be wearing face masks. And then I also want to make sure that if you are doing in-person customer sales, that they're by appointment only, and you need to have plexiglass installed like you see at the gas stations and at the grocery stores. My biggest piece to this in this plan is whatever you write down on a piece of paper as a COVID plan for opening and operating, you need to train on that plan. You need to train your employees on the PPE for that plan, and you need to document all of that training. OSHA will absolutely come in if there's an outbreak of some kind, and they're going to evaluate this plan. So I can't stress strongly enough that once you get this plan down on paper, we need to make sure that we're following it. And so that plan really needs to talk about social distancing. It needs to talk about PPE as it relates to face coverings, and it needs to talk about contact tracing and identifying sick employees and customers. And that's really kind of the bulk of it. There's a bunch of different kind of specific things they ask of each licensee, but those are really listed out really well in this advisory bulletin. And I think if we just focus on kind of the larger preparedness plan that needs to be in place, and the fact that if you put it down on paper, it's going to be expected that you follow it, and your employees know what it is as well.
Awesome. That's great information, Connie. So I want to talk a little bit more about what that plan looks like. Let's say if an employee comes in and they have symptoms, or they find out that they have COVID, what is the business going to need to do at that point?
So the business at that point is obviously going to have to send that employee home. If they haven't been tested, they need to get tested. Then the business has to assess and look at who all that employee has been in contact with within the last 4 to 5 days, and then notify them by letter that they've been exposed to somebody with COVID-19. Now, just because you are in the same space with someone that's been exposed does not necessarily mean you have been exposed. The criteria is that if you've been working with them within 6 feet of each other with no face mask, that's considered an exposure. So not all employees need to be notified, but this goes back to that one responsible person on site at all times, because they need to be tracking who these employees are interacting with. And the last thing you want from a public relations standpoint is to have to call a customer and notify a customer that they've been exposed to COVID from your store or from your facility or from your business. That's not great when it comes to public relations. So, you know, once somebody's been determined to have COVID, they need to get cleared for medically. They need to be able to provide that documentation, and then they're able to come back to work. But then you have kind of that triggering effect, right? So if they've exposed another employee and that employee starts to show signs and symptoms, this process starts all over again, and then you now have to go and contact trace again. So employee A exposed employee B. Employee B is now exposing C, D, and E because it was a really busy day, or you let a bunch of customers in. And the other important thing is you have to report all of this to the health department. Your local health department must know if you have a COVID positive employee, and then you also have to report all those contacts.
Right. Thank you very much, Connie. And what kind of training should these establishments be prepared to do with their employees? What does that training look like? So
training is really broken down into 4 different areas. The first area is training on the plan, right? And that can be just simply, that can be simply sitting down with each employee and just having a conversation about the plan. Or it can be a quick little 10-minute PowerPoint that they space bar through and read it. It's in whatever format you want to do that training. But once done with that training on the plan, your employees need to sign a document saying they did complete that training, and you need to keep that on file. The second area of training is on PPE. OSHA requires you, anytime you bring in work mandated PPE, your employees must be trained on that PPE. So personal protective equipment is gloves when you're dealing with disinfectants and cleaners in bathrooms and sanitizing workstations. That requires you to train on face masks of any kind and its use and proper application of them. You also need to be documenting all of that training on the PPE per employee each time you introduce a new piece of PPE to them. The third area is that you also need to be training, and this is actually mandated that you do this anyway, on cautious and hazardous materials, disinfectants, cleaners that are SARS-CoV or SARS-2 COVID approved. They require cautious materials training and PPE training in order to use those in your facilities. Every single training you do, every new disinfectant that you introduce into your employees, you must be documenting that you've trained them on it, you've trained them on the risks involved with them, and the cautious materials or hazardous materials information that's required by law as it is. I mean, that's something you have to do anyway annually. But then anytime you introduce a new chemical or a new agent into your facility, you have to train everybody on those things. And I actually just remembered, Jamie, as I was just thinking about the training piece of it and disinfecting, if you do have a COVID positive exposure, you do have to shut that area down and disinfect it completely. I forgot to mention that in the last question. So training really is going to be an ongoing thing. It's not just, and this is the planner in me, this is the emergency manager in me, it's not just I typed up this very lovely plan and I'm putting a stapler to it and I'm setting it on my desk and I'm saying, yay, I have a plan, I'm done. The plan is just the first step. The implementation and the follow through on that is what OSHA is going to show up and investigate. Because if you have 2 or 3 people with a COVID outbreak, OSHA's coming and knocking on your door and saying, I want to see your PPE training records, I want to see your cautious materials training records, and I want to see your emergency preparedness plan training records on who you trained, when you trained them, and what you trained them on. Because that's the only way that OSHA can actually figure out if there's some culpability. And OSHA will levy fines on these situations, and they're not going to be cheap. So not that I'm trying to push you don't want to get in trouble and pay a fine, but MRA may also penalize you as well. So you have 2 regulatory agencies, both OSHA and the MRA, who could potentially, if you don't follow these training guidelines and make sure that you're adequately documenting, they can come in and penalize you. And I have every belief in the world that they will do that.
Can I ask a question?
Yeah.
Connie, so I think this is a really great discussion, but let me ask you a question. You got to train the trainer.
You absolutely do have to train the trainer.
The trainer is the hardest person to execute, making sure that all those things are being done properly and effectively.
Well, and that's where from a business development standpoint, right, and Steve, you bring up a really good question. From a business development standpoint, a lot of our licensees are very small, young organizations that haven't evolved into safety managers, compliance managers, HR, those types of levels of people within their organization. And some are just very small businesses where they have to be the HR manager, the compliance manager, the safety manager, the liability insurance administrator, the workers' comp administrator. And so what I'm strongly advocating for is that people reach out. If you need help, get help. You can call myself. I am certainly available to help. And I can get you through these things. I have standardized documents already developed for all the PPE training. And I think the biggest key, like you said, is if you don't have that one person on site responsible and they're a trainer and they know what they're talking about, as a licensee or a business owner, you need to seek out some experts to come in and reinforce this stuff and make sure you're prepared. I would hate to see an outbreak in one of our licensees I would also hate to see a PR mess of our licensees then contaminating customers. And then I would certainly hate to see leveraged fines against licensees because they weren't prepared.
Right, absolutely. Now, Jenny, you've been involved in this space for quite some time. So how have health and sanitation practices changed for businesses since COVID-19 has struck?
Yeah, that's a really good question. Well, I think in the beginning, I think it definitely took a lot of different types of operations by surprise. I also believe that manufacturers were somewhat prepared because in manufacturing they have very detailed, comprehensive SOPs to begin with. They cover health and sanitation. Grows as well to an extent, but I think dispensaries were definitely caught off guard because a lot of dispensaries that I go into, they might have SOPs around like opening and closing procedures, cash handling practices, but they didn't have any kind of health and sanitation plan in place. You know, maybe obviously cleaning duties at the opening and the beginning of the night where they're wiping down counters. So I think some people were somewhat prepared, and then I think a lot of people were definitely not prepared. And it really, for me, I just feel like this whole COVID thing has been like a snow globe, and if you shake up the snow globe, basically exposed a lot of these businesses, their cracks in the foundation, and it exposed, you know, where they were lacking a lot of procedures. And so I think now that this is happening, it's really pushed us, at least in the cannabis industry, to reevaluate and update all of our processes and procedures. One of the things, I lost my train of thought, but I just feel like right now that that people should really review all their standard operating procedures and make sure they have a health and sanitation plan. And echoing everything that Connie just said, which was amazing, all that information should definitely get inserted into your SOPs and make sure that you have that health and sanitation plan. That's all the amazing things that she said, because I think they're really vital going forward, because at the end of the day, we do not know what the unknown is. We have the only thing that we control is ourselves and how we show up and act in our business. You cannot control what goes out in the world. There could be another epidemic or a pandemic that could show up in 10 years from now, and will you be prepared? It could be something else that could happen. And everything that Connie said about being the preparedness plan is 100% important going forward.
Absolutely.
So I have a question for Jenny or Connie. It seems like the guidelines are changing on a daily basis. How are companies staying up to date on these changes?
That's if they're staying up to date. But I think it has to be, like Connie talked about, having that safety manager or that training person on site. That person should have in their job role description that they need to be responsible, making sure that they're on top of all the updates. Everyone should be checking with updates daily. It's not, oh, I'll just check a month from now. It should be a daily routine when you come into work to make sure that nothing's been updated or changed on the MRA. Connie mentioned that the guidelines have been updated a few times. So, are you up to date on how many different times the guidelines were updated recently in Michigan?
So, yeah, and some techniques for that. So, as Jenny mentioned, having that designated person, whether they're working that day or not, and one really easy way to do this is set up a Google search for CDC COVID update, OSHA COVID update, state of Michigan COVID update, MRA COVID update, and those, you can set those parameters for email notifications that they get them daily. Now, daily may be a lot based on the changing standards, but that's really going to be the best way to kind of get to all of that content really quickly and have it delivered right into your mailbox. So a lot of the time, that's what I will do when I'm trying to monitor something, is I'll set that Google search up and it'll come right into my email and I get the updates on things. I know that you can sign up for the listserv with the MRA and OSHA and CDC for COVID. That gets really overwhelming when you get on those listservs. All of a sudden now you have, 10 or 15 different emails of different things coming through. The nice thing about the Google search is it's going to hit your email once. You can hit it for the morning and you can go through all of what it popped up and make sure that you're up to date and then delete that email and move on.
Jenny, you were talking about the SOPs and making sure that you've got, all of the processes in place. Is there a checklist that can be used even on a daily basis to make sure that people are not missing anything? Like, okay, I've done this, I've done this, I've done this. This way, the repetition is consistent and you're following a document that you have to manually sign off on and maybe pass to an owner or something like that. Because I see that, people get busy, they get distracted, they forget one item, but it only takes one item to miss, and then you might have a problem.
Yeah, and that's a good point. I love checklists. When I ran and operated dispensaries in Denver, I had a checklist that I used every day because I was in charge of so many different things in compliance, and I needed it to keep me on track. And Connie, you can jump in here as well because you actually might know if there is a checklist. But I would take these guidelines that MRA has released, and that becomes your checklist. Like, it's very laid out pretty easily that you can literally take that information and you just convert it over to a checklist. Or like she said, you have it stapled, it's on your desk, it's in front of you, and you just review that, making sure that you're following everything you're supposed to. I mean, obviously, once you get the signs posted, you're not checking, did I get my signs put up today, because you've already posted. And I don't know if Connie, if there's a list already made.
There isn't a checklist kind of made, but if you're gonna, I'm also a firm believer in, if I teach you to fish, you're gonna eat. If I give you the fish, you're only gonna eat once, right? Whatever that saying is. If you're developing this lovely plan that you set on your desk, there are daily things, and I think, Steve, this is what you're leaning towards. There are daily things: screening employees, cleaning workstations. Did everybody have a mask on? Were there any, was there any disciplinary action for not following such and such procedure? Did you find somebody, cleaning the bathroom without proper PPE, like the right rubber gloves? So yeah, I agree that if you can take like a daily checklist for that responsible employee, they check that checklist off, they sign it off, and then they turn it in. That's going to be your accountability on the person responsible for making sure that this stuff is happening. Because that's also a part of that OSHA compliance concept is, do you have processes in place to make sure that when your plans aren't working out, that you were notified of it, you were alerted of it, that somebody is reporting in, I did these things. And one other thing that just kind of came up, and Jenny, you can certainly, I need to do a little bit of research, and Jamie, I think I'll wrap back around to you, but I need to see whether or not this is a recordable injury if it's exposed at work. And I think it might be, and that's a whole different set of things that we need to talk about, but that's not listed anywhere in here. Are they claiming it a recordable injury in Colorado? Do you know?
Not that I know of. I know a new OSHA COVID poster came out that they need to hang up in the workplace, but I didn't see anything in there about recording, like basically recording it as an injury. So that's a good question.
Yeah, because for everybody on Facebook and for even the group, when your employee is injured and they have to go seek medical treatment as a result of being injured, including being infected with COVID, I would assume, but I need to research it. You're supposed to be recording those injuries and their days away or days lost from work or days on light restrictions if they got injured, they slipped and fell in the parking lot. So Jamie, I'm going to wrap back to you on that because I think that's really important information, and I haven't heard anything yet about it being a recordable injury, but if it is a recordable injury and they're not recording them, that's going to be kind of a mess too. So that was just kind of a side violation.
That could be a violation as well. And too, I just wanted to add everything that Connie said about the documentation piece. That's basically record keeping. And I think record keeping is 1,000,000% important in this industry. And the fact that if you have that checklist that Steve brought up, that checklist then gets signed and dated, and then that could go into a folder, and then you have some record keeping. So let's just say OSHA or the state of Michigan comes in, you can say, look, I'm tracking this. Here's our record keeping. Here's our cleaning logs, like the bathroom log, everything like that. Those types of tools that you would use in in the restaurant industry, like cleaning bathroom logs, all that should be used right now and implemented, saved as a record keeping, because at the end of the day, record keeping really protects you, and it's not, you know, it's not like you're in trouble or watching every move that you're making. It's really there for mitigation purposes and to protect you as a business, that you're doing everything that you said that you're doing, and here's the proof on this piece of paper.
It's an indirect insurance policy.
Yeah.
Well, it's almost like having your documentation together if you're in court, right? So not that OSHA is court, but when OSHA shows up and knocks on the door and starts asking you questions, I sure would prefer to grab a file of things and hand that to them with my plan and say, well, here's the last 3 weeks worth of records that I kept in regards to our plan. And you guys can go ahead and review that and let us know if we've been doing an adequate enough job at implementing. Versus OSHA comes and knocks on the door and says, let's see what you guys have been doing. Oh, well, here's my plan and all of my employees have face masks on. Guys, that's not going to cut it. That's not going to be good enough in this situation. I mean, you're going to have to elevate your business to a risk management standpoint where you're going to have to start, and you should be implementing safety practices and procedures anyway as new businesses, because there are rules and regulations for occupational health and safety. So yeah, I as Jenny said, record keeping is a big deal. Make sure you're doing it.
And right back to my first question was train the trainer, right? Because that person might not know that this is, you know, it has to go to this level, based on life experience, business experience, or lack of.
Yeah.
Great information, guys. Okay, Jenny, I want to talk a little bit about signage, you know, especially in the retail establishments, because my understanding now that provisioning centers can allow people to come inside their stores now. Yeah. And it has to be like less than, you know, and they have to make an appointment in order to do that. So they have new requirements now as far as signages. Can you kind of talk a little bit about that?
Yeah, I actually printed up the signs because I thought it'd be fun to have a visual. So if you refer back to the MRA guidelines they put out, they have added in several links throughout the document that will link you to the OSHA guidelines, as well as signage that you can print. It's pretty easy. You don't even have to reinvent the wheel. You literally just have to click on the link and print it, and then you can hang it up. I would prefer color. I have a black and white because I don't have a color printer. But, you know, I would print, I mean, if you're doing curbside, even if you're doing curbside, let's just say you're doing curbside, I would find a way to have these signs wherever you're serving customers curbside as well. Laminate them, because obviously the weather comes in. Just find a way so when they're pulling up and they see these signs, even further down the line, if there's a line of cars or whatever, that they're reading these signs before they actually get to the order that they're picking up. So in case they are sick, they can say, oh, wait a minute, I'm going to get out of this line because, you know, I'm reading everything on the sign. Now, if you're actually, you know, making the appointment and coming to the stores, I suggest these signs be on your front door. And there's this one right here that they put out. Sorry, it's not pretty good seeing it like this, but these can be laminated and printed on the front door. I think also you can, you know, put them. Are you going to let customers use your bathroom? Is your bathroom going to be off limits right now? Maybe because right now, if you go through the drive-through anywhere, you cannot use the bathroom. They won't even let you in the facility. So maybe your bathrooms are off limits right now. If not, hang them in the bathroom. This is another sign. It says, please do not enter if you recently been sick in accordance with state law with MRA. These can be laminated and hung up as well. Like I said, you don't have to reinvent the wheel. You can just print these and hang them up. I would just put them, you know, in the bud tending room, just basically anywhere that customers are going to be in contact in the store. That way it's always a constant reminder. Obviously this one, if they're feeling sick, they shouldn't even come in the door, period. They shouldn't even make the appointment if they're feeling sick. And maybe that should even be relayed to the customers and patients as well when they're making the appointment. You know, don't make this appointment and show up if you're sick, basically, and your card.
Can I ask a question then? So if when you're making an appointment, is that by call or by email? Just or is there traceability behind that? And if it's by email, of course, when you set an appointment, then I would think that emailing them these documents also
Yeah.
would be advantageous.
Yeah, kind of like an automatic reply that you
Right.
set up, meaning the minute that a sale comes in, because you can have a sale come in through your website and still get a notification to your business that you've
Sure.
got a purchase that came in for pickup, and then that automatically sends out the documents for them to review before they show up on location. And I
Sure.
think that's a great idea to get this in front of them potentially before they even show up to your property and your licensed
Right.
premise.
And
Yep.
Steve, I assume that that is up to the provisioning center's discretion on how they want to book appointments, you know, and
Yeah.
Sure.
that's just another way that they're going to have to innovate, you know, to the
Yeah.
digital world and kind of figure out a solution for that. Now, since we were talking about signage, I want to bring John Dodge into the conversation. John, you guys do digital signage. Do you have solutions for this type of signages on the digital level?
Yeah, I mean, most of the conversations we've been having with clients in the last 2 months have been focused around coronavirus and how do we message and how do we communicate with customers. And the biggest challenge that we're having is that the message is changing daily, and it's going to continue to change daily until we have all the information and we can set, solid standards that are going to move forward. As it relates to kind of the screening stuff, Connie did a nice job of kind of talking through all the details. We break it down very simply for our customers. You're required in Michigan to have a daily screening. And it's a little bit ambiguous what that means. So the most simplistic way that we position it is it's temperature check, it's a questionnaire, and it's messaging. Those are the three things that we focus on. So it's really about making sure, does the temperature check out? That's a quick thing that we can do. We can scan that digitally, whether that's a handgun or some of the technologies that I'll share in a second. With the questionnaire, there's no reason to reinvent the wheel. The hospital systems have already incorporated what they're asking patients as they walk through the door. The same questions can apply to your business. And then third, with the changing messages, the challenge that we have is that, yeah, you can print something off and put it up, but you may have to do that on a daily basis depending on what's changing. So with these things in place, we're putting together solutions that help kind of address that. Could I share my screen?
Yeah,
Is it
absolutely.
allowed?
Yeah,
All right.
I do believe so. If it's not,
Host disabled attendee
oh,
share.
okay. 1 second. Let me, 1 second, because I will allow that.
And what I'm going to share is
All right,
essentially.
try now.
Try now? Okay. What we put together here to kind of visualize what this could look like. Now, as Freshwater, we're agnostic. There's different temperature scanning solutions, technology solutions that are coming out on a daily basis right now because everybody's addressing that need. But at Freshwater, we're evaluating what those solutions do, what their makeup is. This is an example of what it could look like walking into a corporate office now that businesses are reopening. So a quick scan of the temperature. This is an infrared surface scan, which is fairly accurate if you're not standing out in the cold for a half an hour then walking in, but it gives you a baseline reading of what someone's temperature is. Additionally, we have tablets and NFC or beacon technology that pushes a questionnaire to someone's cell phone, or they can answer it there on the spot with a touchscreen. Obviously, touchscreens are a little bit faux pas at the moment, but offering multiple solutions dependent on the location. And then lastly, the messaging piece. So this is a kiosk. Messaging could be in the form of a smaller display, a tablet. It could be on the temperature scan tablet itself. But we think it's important because a lot of people are having questions. In fact, we talked to some of our clients, some of our larger clients, and HR is so overwhelmed with the questions that they're receiving right now that they're taking folks from marketing, from merchandising, from other areas of their establishment to take hours and take phone calls so that they can answer employee questions. So we know that the questions are going to be continuous. They're going to continue to come up, and it's going to be the same questions. So we're trying to address as much of that as possible through this kiosk. As far as the temperature scan stuff, it's not just taking temperature. So we talk a little bit about accountability and contact tracing and all of that good stuff. We're looking at the APIs associated with some of these technologies. An API is an application programming interface. Essentially what that means is you can take the data that's being collected and you can share that data or you can analyze that data. So for instance, you could have someone walking in, test high temperature, and that's going to trigger an event. And that event could be notifying certain employees. It could be sending that information to the state so the state can start to identify hotspots. So it takes a little bit of that accountability that we talk about off of your hands and puts it in the hands of the technology or a few stakeholders within the organization. The other things that these things can do that go a little bit beyond just temperature check is facial recognition or badge recognition. So being able to identify the individuals that are walking into a space. That's going to be probably more pertinent in a larger office space. The other stuff that we look at is mask enforcement. So these cameras can actually identify whether someone's wearing a mask properly or not wearing a mask at all, and enforcing a mask to be worn before they actually enter a facility. So that's a big one that's actually relatively easy from a technology standpoint. And then with the questionnaire, you know, again, it's tablet based or simple NFC push or QR code. So being able to tap something, and that could actually be done with a print sign as well, where you scan a QR code and it will automatically populate a questionnaire for someone to enter. And then all that information gets collected digitally into a database.
Right. Are there any guidelines right now from the state in regards to temperature scanning?
So, Jamie, they are requesting that you do a screening. Now, does that mean that you actually engage in taking a temperature, or do you provide the employee or whatever group you're referring to a form like the doctor's office? Have you had a fever in the last 3 days? I think they're leaving it up to the individual business as to what they're doing. However, I'm very fascinated by this. This is great, nice work. But you know, it's obviously, it can be expensive to do temperature checks. However, this is going to be going on for some time, and I think we're going to have to be continuing to do this. But yeah, you just have to make sure that you're asking them whether or not they have a fever.
Yeah, and I think to your point, it's not enforceable right now, and I think one of the concerns is HIPAA regulation.
Yes.
Because we're technically in a pandemic that's been lowered, we don't know how long that's going to be the case. But anything that these businesses can do to show that they are accountable, that they're taking the steps that are making people feel safe, it's those things that are going to help them if they do run into an issue.
Right.
It's absolutely PR support as well. I mean, that goes back to, I mean, that's the, you know, one of the biggest questions that, you know, everybody's has is, what is the consumer confidence level of actually returning back to establishments once they open back up? I mean, that plays true to the cannabis industry as well. If you can't get consumer confidence up, then you're not going to be able to get business back to normal, and I use that term lightly. And so, you know, as licensees and other business owners are listening in on this conversation, I'm infatuated with that, because not only are you sharing the messaging, but you're also showing some sort of social responsibility and accountability. And you're also giving consumers a confidence level that they're going to feel comfortable walking into your facility. And frankly, an employee is going to value and appreciate that as well in a very large manufacturing space. You know, just to twist a little bit of a personal to it, I just got a picture from my husband from work. He just got a contact tracing letter this morning from his employer saying, you now have to go get tested. Well, they're not doing any of these things. And so, you know, the anxiety that he kind of walks through every day as an employee, and then all of a sudden he gets this letter handed to him when he shows up to work this morning. He's like, what? So, I mean, this is a great visual that, I mean, if I could encourage people from a signage standpoint, it's a great idea.
Oh, thanks for the endorsement, Connie. Yeah, to your point, it's all about confidence. You know, as a consumer, I go to, you know, drive-throughs or curbside pickup, and I'm paying attention. Are they wearing a mask? Are they wearing gloves? Are they switching gloves after they take my credit card or handle my food? You know, just taking those simple steps that protect the consumer is going to build that confidence. Ultimately, we're never going to have full confidence until we have a vaccine or we're, you know, the numbers are down. But anything that we can do to build confidence is going to help your business.
John, are there different levels of temperature scanning that a business could utilize beyond this?
Absolutely. I mean, it could be as simple as an infrared handgun that someone's sitting there and taking a temperature check. We tend to push solutions for larger organizations, so you don't have a single person that's interfacing with hundreds of people or even possibly thousands of people on a daily basis. So taking that step to remove individuals from the process I'm sorry. What was the? Did I answer your question?
Yeah. You were saying that there are different varieties.
Yeah. So it ranges. So you're looking at a Cadillac solution here, I suppose, if you wanted to use car analogies.
But at the same time, though,
That's why,
John,
there's probably hundreds of solutions that are out there. That's why Freshwater is evaluating what the solutions are. So when customers come to us with a specific budget, a specific need, we can configure a solution that meets that budget, that meets that need. Again, it's not about pushing technology, it's about pushing a solution specifically to your objective or need.
What's the price range?
Everything can range from a couple $1,000s up to $20,000, $30,000, depending on what you want to incorporate.
Got it.
This type of technology is nice because it takes out human error.
100%.
Yes.
Absolutely. Steve Braddock, time to talk to you now. Let's talk about personal protection equipment. So what types of personal protection equipment is required by the state right now?
They're asking for a 3-ply mask. We call them civil masks. And that's just enough to be able to cover it's just your nose and your mouth, and basically it straps around your ear. Other types that actually tie, those are more FDA approved medical grade. When you tie them in the back, it's I'm involved in a lot of different groups and keeping up on what rules and regulations are and how they're changing. And just the FDA and the EPA requirements of all of the different materials that are out there, and those are changing too, right? So just because of the difficulty of even getting product here, depending on where you're getting them from. But typically the civil mask, and that's what we call them, are masks that you can use to go back to work, and it's enough to be able to mitigate your own vapor that comes from yourself and spreading it outward, as well as trying to alleviate inhaling any vapor from someone else that maybe came into close contact with you.
Right, and there's like shields too, right?
Yes, so typically the shields are used for the police or first responders, hospitals, because they're always in close contact with people. There's a couple of different types that are out there, but the key thing is making sure that you get one that you can properly breathe in. If you're wearing glasses, they fog up very easily, so you have to have enough distance between your face and actual mask. So there's different technologies that are out there to make sure that, to help you alleviate that. Even with the masks, you've got a 5-layer, that's more of a medical grade. Then you've got the KN95s and the 95s and all the other higher level 3M brands, and they all are very similar, but the key thing is like the civils are disposables, as well as the medical masks. So they're good for pretty much one day of use, especially if you have hours of usage. I keep one in my vehicle, but it's only 5-10 minutes at a time, but once you get so much use out of it, you want to be able to throw it away and get a fresh one, because unless you have some sort of ultraviolet technology to be able to clean those types of masks.
Right. I want to talk about, because we talked a little bit about provisioning centers being allowed for people to come into their retail spaces now. So I'm assuming they allowed that because the risk is not as high as it once was, but because people are wanting consultations on how to use cannabis. So that means they want to speak to a bud tender on how they can effectively use it. So what type of device would be recommended in that situation if you are close contact and having a conversation on how to use cannabis?
In the retail application, you're seeing these in a lot of smaller stores, even like Dollar General, is they're putting these walls, these clear fiberglass walls, not fiberglass, but plexiglass walls. They could be a 1/4 inch thick and basically suspending from the ceiling. But at least you now have a barrier, and you can openly talk and communicate to somebody and not putting each other at risk, regardless of having a mask or not. But it's always important to have that secondary barrier, having a mask on as well. But another thing that's also important that people don't realize is you can also get the corona through your eyes. So if you're not protecting your eyes as well, that vapor from that other person could be, you could be getting it through your eyes as well. So because it's an open, area to be able to collect the virus.
Are you running into shortages with PPE right now?
We did at one point because of the global pandemic. The companies that are making these products are international, and literally they just don't have enough planes to ship their normal product and all the PPE materials all over the world. So we've had to deal with some long delays, as much as almost 6 weeks from the time that the materials were purchased before they landed. And now we've taken some different paths. We're actually, we're ordering private planes, and shipping them separately so that we can get them within a reasonable amount of time, even through customs. Typically now we're looking at about 10 days now. Awesome.
Thank you so much. Now I have one final question that I wanted each of you to respond to, if you like. I would like to just kind of know your thoughts. How do you think the cannabis industry has responded as a whole to this entire COVID situation? And how do you think the MRA, the Marijuana Regulatory Agency in Michigan, has done as well?
I guess I can start just from my aspect, from building facilities. All of our projects have been put on hold. But of course, the facilities that are already open, they're already growing, and they're already moving forward. They're, regardless of what their limitations are. But anybody that's requiring any construction, now that the construction portion of it has been lifted, we're starting to get back into discussions. Some of our engineers are coming back to work. So even our resources, our suppliers have slowed down and or stopped until just recently. And I've been quite active, at least within the last week, starting to, all those discussions, and pretty much, starting to move forward again. So it's slowly but surely starting to come back and being progressive.
That's great, Steve. Connie, do you have any input?
Yeah, so being on the coronavirus task force with the MRA, we definitely, I think, as an industry as a whole, we definitely moved agilely and we pivoted quickly. I know that my passion for trying to help mitigate initially was because I know that my clients are new businesses that are not going to be able to make it as a brand new business in a shutdown. And so, I can tell you that from a licensing standpoint, licensing is going faster than it ever has. From an inspection standpoint, inspections are getting done faster than I've ever experienced them. From a standpoint of being able to be deemed essential, I think that us not being deemed essential would have absolutely crippled this industry in Michigan. And I also think that Michigan took the lead across the nation, and I'm pretty proud of that. I think that obviously there's some hiccups. It's hard to ask for the world. You know what I mean? It's like in negotiations, you ask for this much and you hope you get this much. We got far more than what we were hoping for. And what I think has happened is that the MRA has seen the cannabis industry be a leader, because we really put some pride into it. Not only were everybody implementing the first rules that kind of came out with curbside pivoting immediately to home delivery, but then we were also, as cannabis licensees and businesses and supporting businesses, donating PPE and making surgical masks and giving them to the hospitals. So I honestly believe, I think that, at least in Michigan, I think we did an incredible job as good stewards, but then we also went above and beyond and gave back to our communities as well. And I think that's something we should all be very proud of.
Based on your point on pivoting, I mean, these are all small businesses. They're all looking to survive. They're put in a very challenging time to do so, if they're even up and running. A lot of them have been delayed, to Steve's point. From the conversations that we're having, they seem to be pivoting quite well. They're looking at these different solutions, the curbside, and how can we fulfill that, and how can we make it a good customer experience. So now it's a good customer experience, but it's also a safe customer experience. So it does appear that these businesses are doing what they can to be responsible and show the right steps.
Right. Go ahead.
I'll chime in. I would say definitely Michigan set the pace because, and Colorado actually has done a really amazing job too. The Marijuana Enforcement Division, Department of Health and Environment out here, we were giving guidelines right away. And I think at the end of the day, to what everyone has really said here is that these small businesses and even the chains, there's some dispensary chains, they don't want to go out of business. And the fact that you were deemed essential, at least in Colorado, we were deemed a critical business. Take it very seriously, and I think people are, because there are because if restaurants are getting closed down, that could be you. You could be losing your business right now and going under. And so the fact that you're deemed a critical business is really a privilege. And do not take that for granted. And I really think that's how people are looking at it, is that we're going to do everything they're asking us to do. And very much to what Connie said, a lot of things are moving pretty quickly here. The Marijuana Enforcement Division is actually running really well. They're still running and operating. You can't go to their office, but they've pivoted really quickly. You can still do licensing and all, but they just had to change the way that they're doing everything. And we still do not have delivery here. It was awesome to see what Michigan did. I was praying that we could be like Michigan in that sense, but our delivery is being held up right now, at least in the city and county of Denver. They haven't opted in, so delivery did not happen, but curbside did. And so I was really impressed with the industry as a whole. I did feel bad for like Massachusetts. That could have been us, because they literally were shutting down our recreational stores here in Denver with liquor stores, and then it created chaos. And the one thing they were trying to implement was social distancing, actually created panic. And then we had thousands of people lining up and hitting liquor stores. And I thought it was crazy, because liquor stores, they didn't have the experience of opening up recreationally in 2014 for the first time like dispensaries. So for some dispensaries, it was like, oh, this just reminds me of 2014 when adult use hit Colorado for the first time in the United States. And I just thought it was interesting how the liquor stores were getting lined up. And if you think about it, I'm glad they actually reversed that order, because people who drink a lot of alcohol, it could cause them to have all kinds of health issues and withdrawing. And then you have patients that are relying on, cannabis. Even on the rec side, there's people who maybe want to have a conceal and carry permit for guns. They might not have a medical card, or they don't want to be on the patient registry, and they shop on the adult use side. So, it was kind of like whiplash here in Colorado. And it was fascinating watching what was going on in Michigan, and I really think they did a great job too.
And you're also putting yourself at risk too with your excessive alcohol, and you're weakening your immune system, and also the potential of not being able to fight off, the virus as well. So, right.
Oh yeah, I agree. I bet you alcohol withdrawal could totally weaken your immune system and put you more at risk of catching COVID. So I'm really glad they reversed that order. But you have places like Massachusetts that didn't allow recreational adult use, and those people are literally drowning and going out of business. But no different than how restaurants are suffering and in Denver alone, all these restaurants are closing down. They're not gonna, even though you can kind of reopen at 50% capacity, they're throwing in the towel. So we're gonna see a lot of businesses go out of business. But I also think in the cannabis industry, we'll also see people go out of business as well, or maybe they have to merge and go under an umbrella, and I think we'll see a little bit of that trickle into our industry.
So we have hit our 12 o'clock hour now. I'm sure you guys are hungry for some lunch. Really quick, I have two favors to ask of all of our panelists, you guys. I ask that you go and check out the feed on Facebook. We didn't have time to get to the questions that were put into the chat. So please go on there. Feel free to answer them. I want our audience to get some answers. That's why they watched this today. Secondly, please go ahead and put your contact information, tag your business page in there, and so that way these people know how to get a hold of you. I also want to invite all of our audience to join us next week. We will be hosting these buzz sessions every single week at 11 a.m. Eastern. I want you, we're going to be talking about how companies are adapting to the digital world or virtual world here, how they're doing it creatively. We have Brian Town with Michigan Creative joining us. I've invited Benzinga and the NCIA to join us. We're also going to have Len with Connect Space, who is the one that developed our app, the Cannabis Connection app, to help keep everyone connected during this time. I also want to invite everyone to join us for one of our virtual networking mixers. It's a B2B one, you get to have one-on-one conversations with people that attend these events. We are hosting one this afternoon from 4 to 5. You can find that on our Facebook page. We are also hosting them on Wednesdays, so feel free to join us. We would be happy to have you. It's a great way to continue building your network and meet others and build trusting relationships in the cannabis industry. Thank you so much to all of our panelists. You guys did a great job. It seems that everybody on Facebook enjoyed it as well. So thank you all for being here with us today. Have a wonderful rest of your day.
Thanks, Jamie.
Bye.
Thank you, Jamie.